Well, good Sunday morning. I'm Jaden Jefferson, and welcome to this week's Community Focus. This morning, I am joined by Dr. Brian Kaminski of ProMedica, and we are talking the COVID-19 pandemic. So thanks for joining me this morning.
Thank you, Jaden.
So would you first be able to give me an idea, because we're in 2022, about to be in 2023. So as far as the pandemic goes, where do you think we're at in this pandemic?
Yeah, well, speaking to you as a healthcare provider in a large healthcare system, what we're experiencing right now are a lot of the effects from COVID. COVID itself as a disease, we've seen considerable improvement. So we've come a long way from where we started. If you remember, just 2 years ago, this was a brand new disease. We were still learning about it. We now have a vaccine, and we have a bivalent booster. We have multiple therapeutics. We've learned how to treat people better, and we've seen our mortality rates go down significantly. So it's a much different disease 2 years later than it was. But as you know, this took a toll on our country, on our local region, and to a lot of people personally. So we're feeling some of those repercussions, and those are coming as secondary effects from COVID. So there's a lot of ongoing mental health issues, there's staffing shortages, there's access to care, there's hospital capacity and hospital volume issues that we're dealing with right now. So the challenges definitely aren't over, but if there is a positive note to this, it's the fact that we've come a long ways in terms of diagnosing, understanding, treating, and preventing COVID.
And I know people have gotten used to the feeling of the pandemic's over, and they've gotten letting loose, and they're not wearing masks as often as they once were. President Biden on Sunday, he did an interview with 60 Minutes, and he even said that the pandemic was over. So would you say that's a true statement for us here in Lucas County?
Well, undoubtedly, there's a lot of COVID fatigue. So, a lot of people have just moved past this and moved on with their lives, and that's really understandable. We all have our limits in terms of how much isolation we can do, how much withdrawing from regular human-to-human contact, staying away from work, staying away from relatives and loved ones. So people do have their limits when it comes to that. And objectively, we really have come a long way. So I believe when the president was speaking to us and saying that the pandemic is over, he was speaking to us from his role as president. He has economics to think about. He has a country to run, and he's not a healthcare provider. When you look at it from the narrow angle that we do as healthcare providers, we definitely know that COVID is still out there. We see a lot of patients each day. There are still hospitalized patients, people getting sick right now as we are talking with COVID and ending up hospitalized. But the good news is it's far fewer than the previous surges that we've seen. So we've been able to contain it, to control it, and we've allowed people to move on with their lives. Certainly we don't want to have people look at this as an on-off switch and just stop all preventative measures and stop doing those things that we know that will keep them healthy and keep the vulnerable people who might be at risk for severe disease being exposed. So we want people to still take precautions, but we do understand that people are going on with their lives. And again, the best prevention is the vaccine. We now have a great booster that's effective against the Omicron variant. So it's brand new, and we would encourage people to go out and get it. And our hope is that people don't view this as COVID is gone. You might say the pandemic's over because we're moving on with our lives, but the disease is still here. We're just learning to live with it.
And definitely something that we're all being adjusted to, because in other places around the world, wearing a mask was a normal thing. And then having introduced the concept here to the United States, it was definitely an adjustment for a lot of people. So looking from a healthcare provider perspective, as you mentioned earlier, what was the impact on healthcare providers like ProMedica during the pandemic? Because it's something that not many people understand that side of.
Yeah, well, I still wear a mask at work. When I go in and step into any of our healthcare facilities, when I walk into the hospital, I'm wearing a mask and wear it all day long. And if I'm going into a patient that's suspected of having COVID or has COVID, I'm wearing a respirator. So those preventions are still in place, and that has changed us. We've learned how to recognize the symptoms, how to detect those people who might be asymptomatic that are in our system, and really how to just manage the disease a lot better. And then again, all those secondary effects. So even though we might not be dealing with COVID very directly all the time, what we are dealing with all the time are the subsequent staffing shortages now that we're running into, and the hospital capacity management issues, and then the access to care. So those things are taking its toll. It's creating some burnout, creating mental health issues, not only in our community and the patients that we serve, but in healthcare providers too. So those are the things that we're struggling with right now.
And looking into the future, we always say there's a light at the end of the tunnel. In this case, what does that light at the end of the tunnel look like? Because it's going to be hard to believe that we're almost going to be 3 years since
Right.
COVID really hit the U.S. So it's definitely something that's crazy to imagine and think about. So what's that light at the end of the tunnel?
Yeah, right now we're learning to deal with it. So I think the light that we can see right now is just learning to live with COVID in a similar way that we learned to live with the flu. And COVID has been demoted. So you remember, when COVID was killing hundreds of thousands of people per year, that number has been significantly reduced. And our hope, and we're pretty close right now, is that we reduce it to the level of the common flu. And we all know what that is. We all have accepted that that makes a certain number of people sick each year, but we also all collectively realize that we all have to go on with our lives and not shut down the world and shut down our lives because flu is out there. So that's our hope, to get there with COVID. I think we're on that track. I think we're close, and I think that's what people should prepare for.
Well, definitely something that I'm looking forward to seeing what, the future is going to hold for us, because COVID was definitely an isolating time and the future definitely looks bright, but we just got to get through the virus first. So looking forward to it. But Brian Kaminski of ProMedica, thank you so much for joining me.
All right, thank you, Jaden.
Thank you, and that's this week's Community Focus.